It's 6:10. When going through cancer treatment, new research shows some patients may suffer adverse effects to the heart. As a part of our Ask the Expert series, I spoke with a cardio-oncologist with Bon Secours St. Francis to see what options are out there. Research from the National Cancer Institute suggests certain treatments can damage the heart and cardiovascular system of cancer patients. Dr. Jason Cuomo is a non-invasive cardiologist at Bon Secours St. Francis.
A cardio-oncologist's job is to get you safely through your chemotherapy.
That means identifying risk factors prior to treatment.
We can get the patient on cardioprotective medicines or increased surveillance schedules to try to keep them safe through the treatment. The goal of the cardio-oncologist is always to minimize interruptions to treatment because treatment saves lives.
But what that looks like for patients can differ.
If it's an otherwise healthy patient without cardiovascular disease or certain markers that we look for, they may only need imaging or maybe a visit within the first year after treatment.
Other patients might see weakening heart muscles, called cardiomyopathy.
The pump pumps less strongly, and in some cases it's actually reversible when it's caused by cancer therapy. In other cases it's irreversible, and we want to catch it as quickly as we can.
Or cardioarrhythmia, an abnormality with the heart's circuitry.
There are cancer therapies that can cause these issues, and we can usually treat those and allow the patient to continue to safely receive their cancer therapy.
Dr. Cuomo says patients who notice any irregularities should consult their oncologist.
The chemotherapeutics that cause weakening of the muscle of the heart will cause shortness of breath, fluid accumulation and swelling in the legs or even in the hands, and maybe racing of the heart.
Dr. Cuomo says with more research comes more therapies, one that could be right for you.
The bottom line is, without treatment of the malignancy, no good things can happen. So we accept a certain amount of risk, and my job is to mitigate that risk, to control it and minimize it to the best of our ability. To submit a health topic for our Ask the Expert series, head to WSPA.com.